Hello, I'm Lauren Haldeman, Editor-in-Chief of the Journal of Nutrition Education and Behavior, where we're advancing research, policy, and practice. Each month, we select an article to feature as a press release with an accompanying podcast. Today's podcast article can be read in full at www.jneb.org for free for the next 3 months. And today I'm speaking with Dr. Katie Sanders, who's the corresponding author for the article titled Qualitative Exploration of Cultural Influence on a Rural Health Promotion Initiative. I'm glad to have you with us today, Katie.
I'm glad to be here.
So can you tell us a little bit about yourself?
Absolutely. So my name is Dr. Katie Sanders. The doctor is very recent. I just completed my dissertation around the project we'll be talking about a little bit more in depth today. My degree is in agricultural leadership, education, and communication, but I primarily focus on science communication related to the food system, as well as culturally responsive evaluation. So you can see a little bit of both of those aspects of my work in this piece. I will be starting a new position at North Carolina State University as the Assistant Professor and Extension Specialist of Food Systems Communication in about 10 days. So I'm excited for this new opportunity.
Oh, that's an exciting step. And you're right down the road from me in North Carolina, actually.
Well, great.
Yeah. Well, great. Thanks so much for that. And can you give us a little bit of an overview of this paper, including what you did and some of your results?
Absolutely. So this paper is a product of a project I've been working on for the past 3.5, almost 4 years. And it's for Healthier Together, which is a CDC-funded high obesity program project in 5 rural counties in Georgia. And we've done different aspects of this project through evaluation over the past 4 years, but we really wanted to take a moment in this piece and re-examine the data that we got from our evaluation efforts to understand the cultural influence on the perceptions of rural food access and physical activity change in the context of policy systems and environmental change. So we know that obesity itself has a lot of complex causations that go beyond just food choice and geography, but it's implicated with issues of class, culture, and identity. And we know that PSE change, specifically in the built environment, is really constricted in rural communities. So we see a lot of work around this lack of access, but we also see a gap in the literature that's comparing this lack of access to how diverse culture and systemic inequities can actually complexify this process. So culture is a really big part of history, and history is a really big part of rural communities. And so we wanted to kind of examine this relationship between lack of access from the built environment, as well as how culture and sociocultural identity kind of interact there. So this overall will help us as practitioners not just create surface level adaptations saying that we're addressing culture. So, okay, if you want to add a certain spice to this, you can still use this kind of food that we're trying to get you to be healthier, and it's related to your culture. That's not really appropriate, and that's not really effective. So what we're trying to do is encourage practitioners to create interventions that are created in alignment with cultural schema of the communities that they work with. So not just having a prescriptive approach that can be mildly adjusted, but moving forward to really getting down at the base of what culture is to create more effective programs and sustainable programs. So we did this based on Healthier Together data. So we interviewed members of community coalitions. So our project is built around community coalitions in each of the 5 counties. And these coalitions, in partnership with the university and cooperative extension, are actually implementing the project on the ground. So this includes creating shared use community gardens, working with food pantries for food distribution, grab and go coolers to increase healthy retail options in food spaces, as well as walking trails, walking signage in the community, really to encourage physical activity. So those are the main interventions of Healthier Together. The community coalitions are formed of different non-formal and formal leaders in the community who are just really invested in the change process. So we conducted interviews with participating members of these coalition members in April of 2020 and May of 2020, which, we all know what happened then. So we'll talk a little bit about how COVID influenced the process as well. So we collected these interviews, we transcribed them, and then we did a qualitative coding process using content analysis. But the way that we did this was through abductive coding. And what this means, it's just a fancy word for recognizing that you're going in to see what we call emerging themes in the data, but recognizing that we as a person and people on this project don't come in just no biases at all. So we're recognizing that our research questions themselves, as well as our experience with the project, influences our coding process. So we are doing coding that helps answer predetermined questions, but remaining open in the data so that we're not predetermining the answers. So we found quite a few things that related to cultural influence on the project itself, and social norms, which was one of our research questions, were one of the primary influences related to sociocultural identity. So we saw that perceptions of physical health and social norms around physical health are really strong to consistently produce health around the status quo. So these counties were actually selected by the CDC for an intervention because they had a rate of over 40% obesity. So these counties were not random, they were chosen for the intervention. So obviously perceptions of physical health were different based in the community than they were for external practitioners coming in. And that's something we saw. We saw folks saying, well, we didn't realize that this was an issue until we got the grant. We also saw different conceptualizations of body image and what a good body is based on cultural norms and social norms. We also saw some interesting relationships with eating habits. Not only did Southern food culture actually influence the food, if you're from the South, you know, most things are fried. I'm from the South myself, so grew up here. But we also saw that staple foods for different communities, such as the Black community church groups, were influential in the status quo of eating habits. Interestingly, though, all of these communities had a history of agriculture, and we saw some folks say that distance from agriculture was a reason that a lot of young folks were not eating healthy. We also saw not only food preferences being an influence, but the way that food preferences were influenced by food availability and vice versa really showed the connection between the built environment as well as culture, and that it's not a linear relationship. Race and history played a big role in these food preferences because these communities in South rural Georgia are still feeling the ripple effects of segregation, and that influenced how people felt welcome in various project interventions. And then physical activity norms I thought was quite interesting because they described themselves as a sedentary community, but they said that that was often because of long commutes to work. COVID actually impacted a lot of group fitness activities, but they also said that people choose to drive rather than walk, which is more of that social norm that's not super influenced by accessibility. But despite all of these social norms, there was quite a bit of hope for the community, as you would expect from the community coalition members, those invested in the project. They really hoped for more community engagement, particularly with underreached audiences. But they did see a lot of increased awareness of healthy behavior and what good could come from more positive health overall. And one thing that we saw that was really interesting from a sociocultural perspective outside of just health is there was an increase in community cohesion across the different cities within a county. They described themselves as previously pretty isolated, even competitive for different resources from the county. But through the Healthier Together project, they saw this increased community cohesion, not only just between cities, but between different people of different backgrounds. So overall, they just wanted people to see value in the change initiatives. They wanted to lower obesity rates, but some of the interesting findings related to culture included this slowness of change and how the cultural rural communities should help us qualify successes by recognizing you're not going to come in and have change overnight because it's a very culturally entrenched, this is the way that my family has done it for generations. That tradition is a big part of the change process. So understanding how we can do change initiatives that are respectful and reflective of the change process is very important. I also noticed that there's a lot more heterogeneity in rural communities. As someone who grew up in the most suburbs of suburbs, I'm learning about this culture alongside a lot of my research partners. And often we as external practitioners come into the community assuming everybody is the same. in rural communities, if you're not from one, you may have a certain stereotype of who these folks are. But there's much more heterogeneity than we initially anticipate, and creating a culture forward program initiative includes highlighting that heterogeneity and providing opportunities for multiple voices to be represented. So that is the overview of our project, but I'm happy to answer any other questions that might come.
Sure, that was a great overview. Thanks so much. And I'm really glad to see the rural community perspective being prioritized in your work. So you addressed a couple of these. What factors are unique to rural communities that influence nutrition and physical activity behavior?
Absolutely. So I talked a bit about that slowness of change. So we need to be able to qualify what progress and success means, not only based on our external perceptions of what are these health metrics that are improving, but how is this improving community cohesion? One of the biggest things that we found from a social perspective is that relationship building is required for collective action. And this relationship building really comes into play when you're talking about these external practitioners coming into the communities and either trying to build community trust or assuming trust is innate and then really not spending time to form those relationships. Social capital is one of the strongest things in rural communities, at least in our project. And being able to integrate that social capital into social networks of change is really important. But they also have strong community pride, and this translates into the need for grassroots action. We saw a lot of people saying it needs a lot more when it's coming from us. We love what y'all are doing. We love that you're giving us these resources, but to create real change, it's important for us to know that it's coming from us and for us. So understanding that community pride, tradition, this is how it's always done, can contribute to slower cultural changes, slower health changes, and the need for relationship building are really three key things that are important for nutrition work in rural communities, as well as understanding what values are important to people. One of the questions that we asked in subsequent years of the evaluation is, what are key words that you would use to describe your community? And overwhelmingly, they were related to faith, family, and friends. And so as we're creating nutrition interventions, we need to be able to incorporate those shared values into the project goals itself to increase the sustainability and the cultural responsiveness of our nutrition programs.
Great, thanks. And I can see so much how that trust factor is critical when you're working with these communities. So can you talk a little bit about how understanding culture can enhance policy systems and environmental change?
Absolutely. So I know that POC change is an attempt to really focus more on these broader systemic impacts and interactions that we need to understand when we're introducing change, especially behavior change, into a setting. But culture is a big part of the system. We see history playing a factor. We see the social capital playing a factor. And these are very strong aspects of culture itself. And so what helps us see these interactions is knowing how sociocultural norms can not only impact the environment, but how the built environment then can impact sociocultural norms. So we saw the descriptions of this sedentary lifestyle. Well, rather than just thinking that's a cultural thing and we need to change this behavior, recognizing that, yes, the built environment has these accessibility restrictions that have been translated into social norms, but we can't just come in and say, okay, well, you need to stop being so sedentary. Recognizing that entrenched relationship between the built environment, between history, and between sociocultural norms can help us as external practitioners not come in and immediately get people closed off to what we're saying. So I think just understanding how shared values and the relationship between the environment, history, and culture can really entrench those social norms can help us not be as maybe flippant about how easy that change can happen. I also think that culture often leads us to more nuanced understandings of equity, diversity, and inclusion. And so as we look at the communities that I had the opportunity to work with, we did see a lot of issues of the ripple effects of segregation in some of our community gardens. So if they were placed in a part of the city or the town that was traditionally not welcoming to Black people in the community. There was a lot of issues of having successful engagement efforts when we as external practitioners perhaps were only looking at certain groups to help us guide those decisions on the ground. And so what this really means is that us as external practitioners working with perhaps the more affluent people on the community coalitions, those who are already involved in change efforts, because one thing you see in these communities is that if one person is involved in something, they're involved in everything. So often change efforts have the same folks over and over. And that can lead to the assimilation of what the dominant culture or the culture of this evidence-based nutrition says is healthy, and that their culture should align with that. But if we can understand how cultural differences can translate into different nutritional factors and recognize that our own cultural values as practitioners don't leave us when we enter into the community, then perhaps we can, through dialogue, focus on those shared values that then can translate to preferred foods, that then can translate to, okay, well, how do we take this and create a nutrition program that is more culturally responsive to the folks on the ground? But particularly, it comes down to this insider-outsider dichotomy. So understanding that we, as external practitioners, have our own cultural values that we bring not only to our work, but also can be brought to our science that then we're bringing into these communities. We are perceived as this outsider. Experts sometimes are seen as condescending in these arenas. So how can we be more responsive in our actions in the communities, recognizing our own assumptions, and how our science, while rigorous and valuable, can also be adapted to be more responsive to these shared values that really underlie most people's day-to-day interactions. I wanted to take a minute to thank my co-authors, Nikisha Randall, who is a fellow graduate student at UGA, as well as Dr. Alexa Lamb, who was the communication and evaluation lead for the Healthier Together project, and Dr. Allison Berg, who was the nutrition strategy lead for the Healthier Together project. So between all of our combined efforts and expertise, I'm really excited at the work we were able to produce.
Interesting work. And I'm looking forward to seeing steps forward. I love how applicable this is to practitioners, nutrition educators. So thanks so much, Katie, for spending some time with me today.
Thank you so much. I'm always excited to talk about this.
Certainly. And to all of our listeners, remember, you can read this article in full at www.jneb.org for free for the next 3 months.